So as mentioned, my name is Tina Chrysochou. For those of you who've joined late, I'm a consultant kidney doctor based at Salford Royal Hospital. And this particular photo was taken from the UK and Ireland's first patient information day on FMD that was held in Salford in 2019. So I'm glad to say that some of the faces are still the same. So unfortunately, if you go from the left, Martin Punter was one of the neurologists doing the clinic with me. He has since emigrated to New Zealand. The neurologist after him also emigrated to New Zealand. But I'm absolutely delighted to have Aparna, who's with us in the chat. I think you could see her photo as well. And she's our newest neurologist. And we are so grateful for her being here tonight and helping us with the clinic. I then have Rekha and Amit Hewatka thereafter, who are two of my most favorite people in the world. They're the most fantastic neuroradiologists. And because Salford is well known as a tertiary and quaternary referral center for neurosciences, they have fantastic expertise in all neuroimaging. And then we've got Karen on the right, who's managed to squeeze in the corner there. So I'm also the principal investigator for the UK FMD study, which is what I'm going to talk to you about now. So let's just give a bit of a background on how we came here. So we have been very inspired by the success and the impact of the European and international, called the FAIRY, and American registries and initiatives. We very much were aware that research on FMD has lagged behind in the UK, and we wanted to join the fray. But the question really was how. We've had quite a few challenges in being able to join in as streamlined a manner as possible. Of course, you've had the issue with Brexit, which meant that there were a few more firewalls thrown up in terms of joining the European registry. A very quick one would be to join as a single centre. So, for example, one of the centres in Edinburgh tried to join individually to the European registry. But the concern with just a single centre approach means that you're not going to be able to access as many centres as you'd like, and it very much relies on goodwill and interest from a particular clinician with this interest. So we took the more difficult course and we decided to go for national collaboration. So this all started with trying to get presence in the renal rare disease registry. So FMD is still regarded as a rare disease, and because each centre is only going to have one or two, some not even any case of FMD, some patients are just managed in primary care, we really do need to collaborate. So we originally formed a specialist interest group under the umbrella of RADAR. So RADAR stands for the Renal Rare Disease Registry. And this was a multi-speciality group. So we had consultants from multiple specialities, and we also had patients in that group. The benefit of RADAR is that it is what you call portfolio adopted, which we'll talk about just now. This essentially means that there is research nursing time that is funded by sort of the national network to enable recruitment. So this originally seemed the best way to go. However, unfortunately, the data that you can collect with RADAR is very limited. And to be honest, it's minimal. And it is absolutely insufficient to make any progress with. The one benefit to RADAR is that if you are in RADAR, then you consent to be included or be informed about other studies. So it means that all the patients who are in RADAR can be contacted to participate in the UK FMD study. So this is just the outline of the UK and Ireland first patient information day that we had at Salford in 2019. And there was a fantastic attendance. This was well before the days of Teams and COVID and everything. So it was a good old-fashioned face-to-face meeting. And not only did we have great talks by experts in this area, but we also had Sally B, who I don't know if she's on this call tonight, but some of you may know her. She's a celebrity chef and a wellness coach talking about her journey with FMD and SCAD. We also had Professor Adlam on that talk. But importantly, after the morning session, we had an afternoon breakout session. And this was very much our chance as clinicians to hear from you and to understand from the patient perspective what was important to you. If you had to draft your wish list right now in 2019 of what you would like or where you would like FMD to go in the UK, what would it look like? And we came up with a consensus of 4 sort of clinical priorities and some research priorities. The first point on the wish list was that patients wanted a dedicated FMD clinic, understandably, because there is such variable expertise and only specialist centers might see such cases. So they very much wanted a bespoke, dedicated FMD clinic. You wanted coordination of your care, because sometimes you'll have care in different hospitals, different trusts, different parts of the country. And, you know, for you to have to try and negotiate the NHS's quirks and hospital quirks is difficult enough, never mind managing an underlying condition. You also wanted acknowledgement and validation of this condition, because some people regard this as a silent disease. You look completely normal, fit and healthy, but there is a lot going underneath that. And it was important to get validation of this condition. And what was commonly described at this day was tiredness. So tiredness was a common concern, but doesn't seem to be as well described in the literature. So this was something highlighted. The research questions are still research questions we are trying to answer today. So of course there's a question, why is it more common in women? And you can see just by the participants on tonight's phone call that the majority are women. There's a question about genetics. Is there a genetic link? Is there a role of hormones? And I can see already all these questions have come up in the chat box. So we'll try and answer what we can later on. And then of course, access to all this research data, but in an understandable format, something that actually means something to you and you can do something with. So it was a very informative meeting. We very much, at least from myself, Anya, and Aparna's perspective, and I think Abby's on the call as well, so I haven't mentioned you. Abby's a cardiologist in London. We very much value patients as partners in this journey. And we can see from the enormous success of other patient groups, how you've helped to inform and support that peer support that you offer other people with FMD is fantastic, but also the fact that you've helped to fund research is equally as fantastic. And I've just put some snapshots of some of the patient groups around here, both in the UK and abroad as well. And the FMD Society of UK and Ireland are also a member of Genetic Alliance, just to help expand the reach and the impact. So you said, we listened, and this is what we have done regarding the first point. There is an FMD specialist clinic at Salford Royal Hospital. Salford Royal Hospital is one of 4 hospitals in something called the Northern Care Alliance Group. There's been a lot of rebranding. So if you see Northern Care Alliance everywhere, that's where that comes from. Okay. We are part of the Renovascular Disease Service. Now, what do I mean by that? We have a long-standing, more than 20-year specialist interest in renovascular disease. That means diseases that affect the kidney arteries. And we have an international expert, Professor Kalra, who heads up our service. We have significant expertise, a number of PhDs and research that has come from our center. So it makes sense to be under that same umbrella with all that expertise. So the FMD clinic started officially in February 2020. We accept referrals all across England. I am personally happy to accept referrals from all across the UK. There have been some challenges, and again, we can talk about that later, but as long as I have a referral from a physician, we can register you and we can see, or rather speak to you, because we're doing everything on Teams at the moment still. So not on Teams, on a telephone consultation still. The clinic benefits from neurology, neuroradiology, interventional radiology, and renal input. We have 2 monthly multidisciplinary team meetings with our separate interventional radiology groups. And something which I didn't expect when I started out doing this clinic was just how many FMD mimics have actually come our way, which has been quite interesting. Frustrating for some, because, for example, some service users have just had an isolated aneurysm or just a dissection, and understandably it helps to know, is that part of a syndrome or a spectrum, or just to label that. And we haven't always been able to classify that as FMD if we go by the strict FMD diagnostic criteria, which we have to do. So actually, I have been very surprised by how many FMD mimics have come and how much I've had to educate myself about all these FMD mimics and signpost to the relevant teams as relevant. The clinic has genuinely ballooned, and over the course of this week, there have been lots of discussions about capacity. So at the moment, there is about a 4-month waiting list, but understandably, I will do my best where possible to see patients sooner, but we do need we do need more capacity to help see all the patients we are seeing. So ultimately, we will be publishing some of our data. This is just a snapshot that Anya has helped us to collect. And this data is probably just a reasonably contemporaneous. So we've had around 80 patients, and around 35 we've excluded FMD. Now, some of these patients we are still keeping under follow-up, and we will be including in the UK FMD registry, and I'll tell you why later. The mean age of diagnosis of our patients is around 42 years old, and that's the range that I've put there as well. 77% female, and surprisingly, and 66% have had the multifocal FMD. Around 66% of the patients have just got renal FMD, or not just, but have got renal involvement, sorry, and 46% have got neck involvement. And 40% are current or ex-smokers, and around 28% have either been on the oral contraceptive pill or hormone replacement therapy. I've listed just some of the conditions that we've also seen coming to our clinic, just out of interest. So let's get on to the good stuff now. So it has only taken about 3 years and a good couple of grey hairs, but I am so delighted to be able to finally say we have a UK registry. We're not allowed to call it a registry though, because again, for some various ethical reasons, so it's called the UK FMD Study. In practice, this is purely the UK arm of FAIRY, so the European International Registry, for many reasons. It makes absolute sense for us to all be collaborating. That way we can compare data, we can pool our information together. This is a collaborative, not a competitive process. So we very much wanted to already align with the well-established FAIRY registry. Salford Royal Hospital are the sponsor for this study, and we're the first centre that have gone live with recruitment. It officially only really went live this week. We had to put in a substantial amendment to allow for telephone or virtual consent, because a good proportion of the patients who come to the FMD clinic in Salford don't come from our catchment area. So we do need to have other means of keeping in contact, and that is often with telephone consults. So we wanted the same to apply and not limit the number of people who could be included in this study. I want to just give my heartfelt thanks at this stage to the British and Irish Hypertension Society, who gave us £5,000 to help with regards to data storage and some of the technical aspects of the study. I want to thank Anya, who's on the call today, for her invaluable support for the multiple iterations that we've had to bounce back and forwards to the ethics committee and helping to get the paperwork aligned and all the various additions up to date. Sincere thanks to Professor Alexandre Persu, who I'm sure all of you will know. He is a tour de force in the FMD world and the most collaborative individual, and has been absolutely pivotal in ensuring that FMD is given the platform it needs on the European and international stage. And of course, there are counterparts in the States as well. And I also lastly just want to thank Hannah and Fatima, who are from our NCA research team. Those of you whose centres are going to be onboarded will soon become very familiar with Hannah and Fatima, who just are helping to ensure that the research teams on your side know what to do. So the first set of invitations were sent out by post this week, and we will be onboarding centres in stages. So every centre can only be onboarded after a meeting that is between the research teams, and then we will arrange a separate meeting with Professor Persu as well, who will just talk through the technicalities of how to use the online platform. But each additional centre requires another amendment to our ethics board. So we have to keep things manageable at the moment, and that's how we've gone about it. You may just want to know also who's included. We've again tried to be we've gone in ambitious, so we want to include everybody with FMD. So our study also includes children, and thank you to Karen and the rest of the FMD group for running our consent forms past young people, just to make sure the language is understandable by those service users. I've already said this bit already, but we're going to be uploading our information directly into the FAIRY platform, and there are more than 50 items, that fields that need to be completed. There is also a material transfer agreement between the labs. So this is not compulsory, but it is optional to give a serum and DNA sample, which we can store at Salford Royal, or your centers can store and post separately to Alexandra's team in Belgium and in Paris. We have got storage space in Salford, though, so we can also collect everybody's serum and DNA and post it out in a larger batch. So all of this is brilliant news. I'm absolutely delighted. I'm so excited to be joining the fray. There is only just one small point to mention. This is more relevant for the research teams. This study is not portfolio adopted. What does that mean? It means that individual centers do not get funding from a national body for the nurses to input into the platform. So we are relying on our co-investigators and collaborators in these centers and the goodwill of the research team. We are hoping that because there aren't significant numbers from each center, that your clinicians who have got a specialist interest in this will help us. I've got good feedback from all my co-collaborators, so I'd like to think this will go to plan. So coming soon to a center near you, hopefully. As I've said, if you have at any point been seen at Salford by myself, just the fact that we've done a telephone consultation allows us to recruit you to the registry. But these are the other centers that will be onboarded in the course of the next few weeks, months. We've got Barts in London. I've just put these in alphabetical order. So Barts, we've got Birmingham, Chelsea and Westminster, Edinburgh, Epsom and St Heliers, Great Ormond Street in London, King's College London, Leicester, and Glasgow have asked to be part of the second tranche of onboarding.